Hi, we're Nia and Marianne from Seren Health Coaching. We are metabolic health coaches who are passionate about good metabolic health for everyone. We also love to chat about all things health and to share as much information as we can with people who want to make changes to their lifestyle but aren't quite sure where to start. We're going to release a new episode every Friday where we talk about a different aspect of health. So do subscribe and let us know what you think. We'd also love to know what you're interested in too. So if there's something that you'd like us to have a chat about, do send us a message and we'll do our best to cover it soon. Hello, Marianne.
Hi, Nia. What are we talking about today?
Well, I couldn't remember who said this, but now for something completely different. Who said that?
Now for something completely different. Yes.
Can't remember.
No.
Anyway, we're not going to talk about a particular health topic today. Instead,
Okay.
we are going to talk about something we have developed that
Oh,
we think
yes.
will be really helpful for our lovely listeners.
Yes, we absolutely believe we've developed something that you might find really useful. And for most people, actually, if not everybody, if it doesn't apply to you, it will definitely apply to someone else in your life. So if you listen to our podcast, you know that we're passionate about metabolic health.
Mm-hmm.
And you might wonder what metabolic health is all about. And certainly, we know that if we talk about metabolic health, most people won't know what we're talking about. And that's, one of the real problems for us is we are selling something
That people
to
don't know.
people who don't know what we're talking about. Okay.
Yes, so we get those blank stares, but then we
Yes.
explain that your metabolic health is a lot of different things like your blood sugar, your blood pressure, cholesterol, your fatty liver. We
Yeah.
could go on and on.
Diabetes, type 2 diabetes, obesity. Yeah,
Mm.
go on.
But we know, don't we, that when we look at things in terms of what we're dying of as a
Yeah.
population, we know that people are dying more now of so-called diseases of lifestyle, of metabolic ill
Yes.
health, rather than the infectious diseases that we were dying of hundreds of years ago. So bad metabolic health is basically a collection of chronic diseases that are caused by your
Yeah.
metabolism misfunctioning. And there's two reasons for that. Firstly, the environment in which we live. So we've
Yes.
talked a lot about in our
Yeah.
previous podcasts about what's wrong with the environment we live,
Yeah.
but also the genetic hand that you are dealt,
Of course. Okay,
which
so
you
those
can't do anything
two
about.
things. And when we talk about the environment, what we're talking about really is probably the socioeconomic status of people within that environment too. So you handle your environment better,
Mm,
the higher up that socioeconomic sort of graph you are,
mm,
because you have more options and more choices. Often those people with lesser socioeconomic status will have less information and less choices and options, and are more likely to suffer from chronic diseases that affect our modern world. This seems incredibly unfair. So
mm.
in a way, we're saying you can buy yourself better health, but of course, ultimately, it it isn't all about money. Even some people who are well informed don't buy metabolic health.
No, absolutely. So there's so many different factors. It's our food supply, it's how we're marketed to, which,
Yeah.
is very powerful, how we're told to eat. It's also a symptom of the chronic stress of our lives, in our
Yes.
working lives, in our family lives, in our constant quest to be busy and productive and successful, in
Yeah.
this unbelievable message that we don't need to sleep, in our
Yes. Yeah.
deprivation of
We
sleep.
almost show off about sleep deprivation, how productive we are, about achieving, about
Yeah.
wealth, about all
All
those
of this
things that.
nonsense, not being as active as we used to as well.
So isn't this the perfect storm? Not only that, we much more sedentary because we work on screens, a lot of us.
Mm,
So that's another big factor. And we have actually seen children now struggling with weight management, for instance.
mm,
So it's getting younger and younger in this generation that these metabolic disorders are starting to sort of pop.
yeah,
We often say 70% of chronic disease is caused by metabolic ill health. So, of course, not everything is avoidable. Um, and, people do worry about their genes, but there are definitely ways to play your genes well. Um,
absolutely.
so we're not moving very much. We're eating lots of very densely calorific food that's cheap and convenient and easily available. and it's not always the best for us. We're not sleeping as much. We're stressed to death. Well, there you go.
Yeah.
Scene is set.
Absolutely. So massive problem. And it's what you and I dealt with pretty much on a daily basis, didn't we?
Yeah.
Majority of our careers. We saw obviously other things as well, but by the end of your practice and mine, really the vast majority of our patients were struggling with these issues. And
Yeah.
we both noticed things were not getting any better despite, massive funding into new research for new medications. And I think both you and I, being of a curious nature, thought, what is going on here? How do we make a difference to this? What can we do?
Mm.
What we're doing is not working.
No, in many ways, I always say my patients taught me everything, and they did. Once you've seen the source of the problem, which is the way we live within the environment that we live, and you add your genes or your sort of hand of cards into that, this all begins to make sense. So rather than just looking for that medicated fix, which we were probably both brought up on,
Mm,
what our curiosity brought us to, I suppose, is there a way to find and optimize this along before that fix, which,
yeah.
as we know now, isn't altogether a fix.
Absolutely. So certainly when I was coming, to my qualification, we never appreciated that lifestyle
No,
could be as
no,
powerful as we know it is. So it was always, we'll give the patients lifestyle advice, but it's the poor cousin of
yeah,
medication, really, because we've got all
yeah,
this evidence for medication. We know this works. And
yes,
lifestyle didn't have the same evidence base. Um, there was, I think, a wrong idea as well that people didn't want to make changes. They just wanted to take the
yes,
pill and get on with it.
yeah,
But actually, as you say, the patients teach you everything you know.
yeah,
My patients taught me they didn't want to take medication.
yes.
Um, they
Well,
didn't
we sort
want
of
this.
know that, don't we?
Yeah,
Because
yeah,
50% of them didn't take the
they did.
stuff that was prescribed.
Yeah. So they don't want to take it in the first place. Then they had to deal with some quite challenging side effects from some medicine.
Yeah.
They don't always take it properly. And then without actually addressing the root cause of the problem, the medication doesn't always work anyway. So
Mm.
I think that was a big thing for me when I realized that actually it wasn't as simple as just giving these
Yeah,
patients
exactly. So
this
we
answer.
sold people a pup, didn't we, really? I don't think, as you say, we really gave them lifestyle change as a credible option because
Yeah.
we ourselves weren't convinced of it.
Mm.
And we also weren't convinced that patients were capable of making these changes. How patronizing and naive I was when I think about it. Of course, there were patients who said, look, I don't want to change anything about my lifestyle, just give me the fix. But they were
Mm.
in the minority, actually. Most of my patients were very interested in making a contribution to their own health. And it was a
Yeah.
very empowering pathway because once people felt that they could make a difference themselves, everything else followed. For me, this was a huge pivotal change. I think looking back, many of our patients taught their health professionals how it's done, actually. It
Yeah.
wasn't the other
Yeah.
way around. We were also bored with preventative medicine in a sense. We liked the clinical fix that made
Mm.
sense to us. I think, selling people lifestyle was considered a bit sort of, low
Yeah, well,
key.
you've got all this knowledge, you've got all this information,
Yeah.
so why are people coming to you
Yeah.
for all of this other stuff? No.
Yeah,
So,
exactly.
yeah, I
Yeah,
think both of us were taught a lot by our patients, and that's why we got
absolutely.
so
Yeah,
passionate about trying to help the incredible amount of people who in our world are really suffering from just even the early effects of poor metabolic health.
yeah.
Um,
Okay.
so knowing all of that as our background, how do we know if you're metabolically not very well?
Well, we've sort of touched on it, haven't we? You're more likely to put on weight around your middle. You're more likely to feel sluggish. You're more likely to have high blood pressures, disturbed lipid profiles,
Mm,
high cholesterol levels. There are fatty livers out there. There's blood sugar abnormalities. It's all out there. It's all part of that same story.
mm,
And when you paint a picture, I always think it's that picture of you being sluggish in the morning, stressed, sleepless. You don't feel energized. You use things like coffee to get you going.
yeah.
Um, So, the idea is the alternative to that is optimizing your metabolic health and feeling great in the morning and facing the day with much better mood, productivity level. I mean, what is not to like about metabolic health?
Well, quite. So, if that's you,
Yep.
or if it's someone you know,
Yep.
let's tell you what we've developed to offer you.
Yes. Yes.
Right.
After all that, what we're
After all
actually trying to say is
that.
we've done something really cool.
Yes. So we have written and recorded an online course and we've called it the 7-Day Metabolic Kickstart.
Yep.
And we have taken the 4 pillars of good metabolic health. So diet or nutrition, activity, stress, and sleep.
Yep. Yep.
And over the 7 days, we have done something which we feel is quite unique. We have combined both health education, so telling you
Yep.
about what you could do to improve your health, and health coaching. And we think that this combination is what
Yep.
is going to empower you to make the changes you need to make. So, we also live in the world that you live in. So we
Yep.
know it's incredibly confusing. You're being told, what you should be eating, how you should be eating it, when you should be eating it, what exercise you should be doing, what you should be doing to help you sleep, what you should be wearing to help your stress. And it's incredibly hard to sort the wheat from the
And
chaff
confusing.
and
Yeah.
very confusing. So we have developed something that's not a fad diet, it's not a viral
Yep.
exercise regime, we're not selling you a supplement, we are not giving you a meal replacement or any of that jazz. We aren't offering magic pills or solutions because we simply know they do not work. And if they
Yep.
sound too good to be true, they absolutely are. And from our perspective, we're here to get serious with you about changing the things that will help you improve your metabolic health. And it's not a quick fix, it's all about long term change.
So although it sounds like a quick fix because we're talking about a kickstart and it's only over 7 days, in many ways, it depends where you are on that
Mm,
readiness to change scale. And even if you do our 7-day course and it just sows the seeds and you start to contemplate the changes that might change your life, that in itself is a really valuable exercise. So remember, it'll depend where you are and how you're thinking. But
mm.
we know the rewards are huge for everybody. So you can change your life at whatever point you are. Either you're going to look at prevention or you're going to look at energy and living well because you want to feel good and you want to
Mm,
make the most of the opportunities you've got, the relationships you have, the choices you have. Or maybe you're already living with a chronic metabolic disease and you want to look at reversing as much as you can and living well with it. It's also part of aging,
mm.
and I'm hugely vested into aging well, of course. So you're more likely to develop chronic diseases as you get older. So that's another really good reason to optimize your metabolic health as you grow older. You might get away with things when you're young, but this will catch up with you the way you live. So there's
Mm.
lots you can do to improve the quality of all of this. And it's all part of that metabolic health story. And we are passionate about giving you a start in this Kickstart program.
Yeah, absolutely. So let's tell the listeners what they get. This sounds like a
Yeah,
game show.
yeah, yeah,
Okay, so each day you have the delight of seeing us on a video talking you through
yeah,
the topic for you.
yeah,
But then you also have some downloadable PDF resources that you can choose to use if you would like to help
yeah,
you. So they're things like helping you set your goals, helping you evaluate where you are. As Marianne said, we did call it the 7-Day Kickstart, but you can take as long as you need to go through it.
yeah.
And once you've bought it, it's all yours for as long as you want it. Ideally,
Right.
you'd come to the end of that week and you'll have started on your journey to something that will carry on going and be lifelong and make a huge impact on your metabolic health. And then you can go back and use it again. So once you've mastered one small change, try another one, go through the same
Yeah,
process. We have deliberately made it £40. It's £40 for one off access. And the reason that we've done that is because we completely understand that, as we said at the beginning, a lot of the things that people want to do for their health are just completely financially out of reach. The wealthy at the top of the end of the scale, they've got money for the private chef and the personal
yeah,
trainer, but the others
yeah,
other people might not. And that's never been the way we've worked, because we've always worked for the NHS, which is sad for us because we're never going to be millionaires, but it's good for you.
No, we're not going to the Bahamas on holiday, but we really, really want to sell you something that's great value, and this might be the best money you've ever spent on
Mm,
yourself. As they say, health is wealth that money can't buy, and that
yeah,
is so true. And we want this to be as accessible to as many people as it can be, and we think it's a really good value.
yeah. So now that you're sufficiently enthused and you know it's not going to hit you too hard in the pocket, you might
Mm.
think, actually, I'd really like to do that, Nia. How do I sign up? So you can do through our website, which, if you haven't been on there before, is www.serenhealthcoaching.co.uk. And once you pop onto the website, you'll find it's really easy to see the 7-day
Yeah,
metabolic kickstart. You create an account, you sign up, you pay your fee, and then you get lifetime access. And you can keep going through it at your own pace. You go forward, you go back, you rewatch, you
yeah.
re-download at any point in the process. And then at the very end, there is a feedback link because we love a bit of
Oh,
feedback.
yes. And we're very excited to get feedback, because this has got to work for you. This is not about us. And we're really happy at this stage to get your feedback and modify things. If you tell us what worked well for you and what didn't work so well, we really, really enjoy constructive feedback. So don't hold
Yeah,
back. So this might also be part one for you. If you do need more help and support beyond this, there's lots of other options for accessing us. So we're excited about launching this Kickstart program. Go and do it and give us your feedback and tell your friends about it. By the way, you could have it for your birthday. You could have it for Christmas. You could give it to your mum. You could give it to your dad. Who doesn't like
the gift of health.
something that's going to change your life like
Yeah.
this?
So it's the gift that keeps on giving. I do love
Yeah.
that. So, yes, that's what we wanted to share with you today. We'll be back next week with more chat around other things health topic related. But do go and check it out, have a look, and let us know what you think. We'll see you soon.
Lovely. See you soon, yeah. Bye for now.
Bye.